But let's start with the causes for PAD. So what are the risk factors, and are they the same as a different heart condition, let's say?
So peripheral arterial disease shares its risk factors with heart disease in general because it's the bigger arteries of the legs,
Right.
and it's the same. So the main risk factors for PAD are atherosclerosis, high cholesterol and high blood pressure, diabetes, obesity, and physical inactivity. And the biggest one, I think, is smoking as well.
Tell me why smoking? It seems to always be the #1 cause for heart disease of any kind.
So smoking by itself damages the interior lining of the blood vessels, which leads to the buildup of the atherosclerotic plaque. The fat sticks to the damaged inner lining of the blood vessels.
And weight as well. We see obesity is one of the factors up there. How are people who have obesity more at risk for heart disease?
So obesity in itself is an inflammatory condition. So it causes inflammation of the inner wall of the blood vessels, which makes the fat stick to the blood vessels inner wall, and that's what causes atherosclerosis as well.
And that atherosclerosis is actually the #1 risk factor that we saw up there. And we have an image that you're going to walk us through and explain to us what this condition is and what it means in heart disease.
Okay.
So what are we looking at here exactly,
So
Doc?
this is one of the blood vessels. So this is the inner lining of the blood vessels. And as you can see, like over here, the yellow stuff you see, this is all the fat. And usually this is related to the fat intake from the diet as well. So, and this is the inner layer. So sometimes, like with inflammation and diabetes, so there's some breakage in the inner wall, which can lead to the deposition of the fat just beneath it. And as you can see, the lumen here is the narrowest, and over here is the biggest. So this is essentially what's causing the narrowing of the blood vessel.